In contrast to the shoulder joint, the hip joint has a greater degree of bony interlocking and therefore has a more limited range of motion. The majority of the muscles that move the femur originate on the pelvic girdle and insert on the femur. There are three muscles that medially rotate the hip. The gluteus minimus and gluteus medius both originate on the ilium and insert on the greater trochanter of the femur. Since both muscles insert on the same site, they essentially perform the same movement. Another, more superficial medially rotator is the gracilis. It originates on the pubis and inserts on the medial part of the tibia. All three medially rotate the hip. To oppose these muscles, there are many small lateral rotators. They originate on the posterior pelvic girdle and sacrum. They also have essentially the same insertion on or near the greater trochanter of the femur, and so they all have essentially the same action. These muscles include the following: piriformis, superior gemellus, obturator internus, inferior gemellus, obturator externus, and quadratus femoris. In addition to the small, deep muscles, the gluteus maximus also laterally rotates the hip. It originates on the ilium, sacrum, and coccyx, and inserts on the gluteal tuberosity of the femur. Altogether, these 7 muscles act to laterally rotate the hip. In general, the medial and lateral rotators, except the gluteus maximus, also work together. These muscles also act synergistically with the tensor fasciae latae, which originates on the iliac crest and inserts on the lateral condyle of the tibia by way of the iliotibial tract. All of these muscles abduct the hip. The gluteus maximus is a large, superficial muscle of the buttock region. It is a powerful extensor of the thigh. The hamstring muscles, the semimembranosus, semitendinosus, and the biceps femoris are all hip extensors. They all originate at the ischial tuberosity and insert on the tibia. Lastly, the posterior part of the adductor magnus also originates on the ischial tuberosity and inserts on the linea aspera of the femur. Taken together, all of these muscles provide powerful hip extension, or, in its reverse muscle action, a powerful extensor of the torso. The anterior part of the adductor magnus originates on the pubis. So do the other hip adductors, the adductor brevis and adductor longus. These muscles insert on the linea aspera of the femur. The pectineus, like the adductors, originate on the pubis and insert near the linea aspera. The superficial muscle, the gracilis, and the pectineus contribute to the action of the larger adductor muscles. Taken together, all of these muscles provide the movement of hip adduction. Many muscles adduct and flex the hip. These include the pectineus, the adductor magnus, adductor brevis, and adductor longus. Another muscle, the rectus femoris, flexes the hip but also affects the knee joint. The muscle originates on the iliac spine and inserts on the tibial tuberosity. Finally, the prime mover of hip flexion, the iliopsoas, originates on the bodies of the lumbar vertebrae, the iliac fossa, and the sacrum, and inserts on the lesser trochanter of the femur. This large muscle and the other synergists act to provide the movement of hip flexion.